Welcome to News West 9's West Texas View with Johnny Lou Avery.
I'm so pleased to have in our studio today two med students. These are third-year medical students, and they are already in the phase where they're shadowing doctors. They're going and working in the hospitals and the clinics, and so they are near doctors is what I call it. And they are looking forward to becoming full practicing physicians. And over the next few weeks, you're going to meet several of the people from the medical school, our Texas Tech University Health Science Center. We are so fortunate to have it in our midst because it's such a resource, not only of doctors, but of training doctors. And so we're very pleased to have the opportunity to introduce to you this morning two of the med students. And Nicole Mitchell and Robert Vasquez are OBGYN doctors, but as Dr. Jane has told us in the past, all doctors, regardless of what their specialty is, rotates through all of the disciplines. So they have some training in mental health, they have some training in internal medicine and all the other things. And so when they come out, even though their specialty is that, they are well-rounded in the other areas too. And so Nicole and Robert, I'm so pleased to have you here this morning.
Yes, ma'am.
And it is going to give us a time to talk about something that I think you two have really zeroed in, and that's diabetes. But before we do that, I want us to learn a little bit about you. One of the things my audience tells me they like about the program is that they really get to know the guest. So Nicole, I want you and Robert both to tell us a little bit about your background and end up with how you chose to go into medicine.
Okay, so my name is Nicole, and I am originally from Lubbock, Texas. Born and raised in Lubbock, Texas. So coming here to Odessa is actually my first time ever, living outside of home. So this has been a really good experience for me. I went to undergrad at Texas Tech and then went into Texas Tech School of Medicine. So one of the reasons...
And that's unusual because you usually have to apply at a number of medical schools and wait for a while, but
it's very competitive, but I was actually lucky to go through the Honors College Early Acceptance Program. It's a pretty competitive program, but I was able to go through and go immediately to medical school.
So did you graduate from with your undergraduate early? So are you a younger student than most?
I'm a younger student than others, yes, because I went straight through. The average age is about 27, 28 in medical school, and I'm pretty much the baby. But yeah, one of the reasons I did want to go into medicine, I learned in high school. I went to a medical magnet program in Lubbock, Estacado High School, and we were able to shadow doctors during high school. Every day of the week we would go to the hospital and shadow doctors. And I was actually in the L&D unit one day, and there was an opportunity to help deliver a baby. And it was either I go deliver a baby or I have to get on the bus to go back to school. Well, I decided to miss the bus and just go help deliver the baby. So I went and, I was right there helping the doctor deliver the baby, and it was amazing. I knew, like, from then on,
that minute,
this is what I'm going to do. This is what I'm going to do. So, yeah, it was just meant to be. So that's when I really realized this is what I want to do. So.
And even though you looked ahead to what was the requirements and the onerous years of going to school, that you were so sure
it doesn't matter. It doesn't matter. Yeah.
And so you want to stay in this area to practice?
I would actually like to go to residency outside of Texas. I was born and raised here, so I'd kind of want another.
Just for the experience.
Yeah, just for the experience, and maybe come back here to practice because my family is here. But I would definitely want to get that experience outside of Texas. So,
good. Okay, Robert, let's hear your story.
Yeah, I'm from Andrews originally, so I'm from the area. And actually went to undergrad at UTPB, so it's good to be back. Actually, because I lived here. Yeah. So Lubbock was actually like the first 2 years of medical school we spent in Lubbock. So that was really the first time that I had actually moved away from this area. So it was a good experience. But coming back here and seeing how much it's grown, it's been really neat. So growing up in Andrews, we have just a handful of physicians, and they really know.
And not any specialties.
Right. Well, I had a pediatrician. We had, family practice, but for the most part, they're just general, practitioners, and but they know the whole community, and they know everyone. So I grew up with a pediatrician that really knew me well, knew my family, knew my cousins, my aunts and uncles. So it was really personal. It was just a good experience when I went in.
Personal care,
right?
That he knew everything about you and could really advise.
Exactly. So I think, as long as I can remember, I've always wanted to do that and have that kind of relationship with people. So there was never really any other option for me.
And one of the neat things about our Texas Tech Medical School is they have really got a commitment to rural health.
Yes, ma'am.
And so when we're talking about these very small communities that don't have a lot of access to a lot of medical without driving to one of the larger cities, it makes a difference to have a doctor that loves that town and loves what he's doing. Have either of you had relatives that were in the medical profession? Did that inspire you in any way?
No, I'm actually the first one ever to go to medical school. Few relatives have even graduated from college, so this is a brand new experience for me and my family. So,
got a few nurses, but no doctors.
And one of the things that I've had feedback from the audience in the past when I've had doctors or allied health professionals on is they would say, well, my granddaughter or my son has shown an interest in medicine, but we don't think we could swing it financially, or we don't think we could wait 8 years or whatever for him to start working. And so what would you say to someone who said that to you? That there's sacrifices, but there's ways to go.
Definitely.
If you really want to, and if you have the aptitude.
Right. I think all it takes is a hard work ethic, and you have to really be passionate about medicine, about caring for people. It is a lot of work, but the rewards are great. And just seeing how you affect others is the best part. As far as financially, you can get student loans, and that's how a lot of us do it. And you don't have to depend on your family for money. It can just be you on your own. And other than that,
there's a huge doctor shortage in America right now. And we really need good, smart, young people that are ready to make a difference in people's lives. And the money's out there. You just have to be very dedicated, very smart, and very focused and determined to make your dreams come true.
And one of the things that you're saying along the shortage of doctor lines is that with our baby boomers now reaching the age where they need doctors more and more, and the fact that so many of the doctors are at the retirement age that we have out there working right now, that we're seeing that everywhere. The hospitals are just scrambling for nurses, PAs, everything, every kind of medical person. So I want to explore, maybe get you to come back another time and us explore some of these other issues. But in the meantime, we're going to come back after the break and talk about diabetes. We'll be back in just a minute. Join us then.
Stay tuned. West Texas View will be right back.